In today's Health Alert, popular GLP-1 medications may do more than just help women lose weight or manage diabetes. A recent study shows they may also help lower your risk of breast cancer. Here to break it all down for us is our chief health editor, Dr. Nandi. So tell us about this study and the findings. Is exciting to hear.
Exciting stuff for me too. Yeah, the study offers encouraging news, and I'll tell you, it was published in the journal JCO Oncology Practice. And what the researchers, Kellen, did was review health records for more than 111,000 women, a lot of people, seen at the University of Pennsylvania Health System between January 2022 and June 2025. And all were overweight or obese and between the ages of 45 and 50. And here's what they found. Women taking GLP-1 medications were about 30% less likely to develop breast cancer compared to women who are not taking these meds. Now, this was an observational study, right? So, which means that it found an association, but cannot prove that the medications directly prevented breast cancer. That being said, the findings are certainly worth additional research because breast cancer is the second most common cancer among women, and it's also second leading cause of cancer death in that group. So anything we can do to prevent that would be great.
Do we know which GLP-1 medication we're talking about, or all of them might help lower the risk of breast cancer?
Yeah, there are a lot of them right now, right? So first, GLP medications can help people lose weight. After menopause, fat cells produce estrogen, and higher levels of estrogen we know are linked to a greater risk of some breast cancers. Second, being overweight or obese can create ongoing inflammation in the body, and that's been linked to a lot of stuff, including a risk of cancer. Also, people with obesity often have higher insulin levels, and that may play a role in the development and growth of some cancers. So taking GLP-1 medications, that is, may help reduce inflammation, improve insulin sensitivity, which could help lower that risk. There's also some evidence suggesting that these medications may actually help reduce tumor growth and slow cancer progression. All good things. As for which medications you asked, right, were used, researchers did not track which specific GLP-1 drugs were used, Carolyn, and women were taking, and also how long they were using them. So we can't say whether one medication performed better than the other, but regardless of whether someone takes GLP-1 medication, screening for breast cancer remains one of the best tools to have for early detection because it kills women, and anything we can do to prevent it would be great.
Absolutely, and we're just going to have to continue to follow them because
100%. I think so many people are using it. We'll get more and more data, and as we get them, we'll talk about it right here.
Good deal. Thank you so much, Dr.
My
Nandi.
pleasure, of course.
As always, appreciate you. Now, this week on the Dr. Nandi Show, should all men be screened for prostate cancer? Dr. Nandi examines the latest thinking on screening, treatment, and recovery, of course. Plus, survivors share their stories. That's coming up Sunday at 1 p.m., so make sure you tune in and check it out.